My name is Bracia, and this is my story on living with hip dysplasia. I started having a really dull ache in my right hip that would keep me up at night. Subtle things like going to the bathroom in the middle of the night became really challenging. My story with hip dysplasia starts all the way back about 4 to 5 years ago when I had just finished treatment for Hodgkin's lymphoma cancer. I would notice the pain would flare up at random points, and I saw lots of different doctors about this, and we had kind of a series of trying to figure out what was going on with my hips. I ended up seeing a specialist at the Mayo Clinic who deals directly with patients who have hip dysplasia, and we were able to go in and do an x-ray and different tests to evaluate the degree in which my bone was sitting, and ultimately my pain continued to get worse and worse. And I remember there were nights where I couldn't even get out of bed and I was screaming, crying through tears. I would keep my phone by my side so I could call my parents and ask if they could come and help me in the middle of the night, bring Tylenol, help me get to the bathroom. This pain became so significant that it was affecting every aspect on my quality of life.
I've been going on almost a week of severe hip pain that's been preventing me from walking, so I'm about to do a cold plunge because it feels like it numbs the pain.
So I had a consultation with my doctor, and he kind of sat me down and said, look, you can, 1, keep living with the pain, and then eventually you'll need a total hip replacement, or 2, you can do a surgery called a PAO surgery. I had an eating disorder growing up, and then I had Hodgkin's lymphoma cancer, and getting chemotherapy and steroids and affecting my bone density and all of those things. He said, you are kind of in the prime to be considered as a candidate for this surgery, and if you wait much longer, we'll have missed that surgery window, and then you'll eventually just have to get a total hip replacement. I really didn't have 2 great options, but I knew I could no longer live with this pain. So I decided to move forward with booking a PAO surgery on my right hip.
Okay, we are about 6 days away from my surgery, and my pain today is at like a 6.
I knew the recovery time with the PAO surgery was substantial, and up until this point I had been through a lot mentally and physically with my health, and I knew how to get through hard times, but I really didn't anticipate just how hard this recovery would be. My right hip surgery was on June 25th, 2024.
Breathe in, 1, 2, 3, 4.
I am strong. I am brave. I'm in good hands, and I can handle this.
And my incredible surgeon really did an outstanding job. He did find, however, that I had softer bones, potentially from the chemotherapy and steroids I had in the previous years, and with that in mind, he had to do 4 screws, which is more than they usually do on patients, and for whatever reason, I had a harder time in the hospital recovering. Generally, you're in the hospital for 2 to 3 days post-surgery, but I was in the hospital for a full week. And while I was in the hospital, I remember having intense pain. I had physical therapists come in, and the big goal was trying to get me to stand up out of bed, but it was so painful. I couldn't even turn turn my leg on the bed and put full weight down. And to be fair, you're not supposed to put full weight on your leg for weeks after your surgery. So we ended up getting a walking device that once I mounted onto it would lift up. So it took the weight off of both of my legs and I basically used my arm strength to maneuver. I think it was on day 3 when I was able to successfully turn in the bed and stand up with the walking device, and I was constipated from the pain medicines. I had been using a catheter for urination, and finally they took the catheter out, and currently in the hospital, I think it's day 4, just learning how to move around again, and I'm on pretty big pain medicine and just trying to deal with the pain, but I'm staying strong, and this can be a long road, but it's all gonna be worth it. And this thing is helping me keep my lungs moving because I'm pretty stationary right now. And I do it like 10 times every hour. Eventually, when I was discharged from the hospital and able to go home, simple things like getting in the car and situating a pillow under my leg and safely getting home and avoiding pain with bumps and traffic was not easy. I quickly realized once I got home how much my life had changed, at least for the next few months. Some things that I had to continue doing when I came home from the hospital was pretty much rely on help 24/7. I was fortunate to have my parents' help and my boyfriend, and my grandma came to town. If I had to use the bathroom, I couldn't get to the bathroom quite yet, so I had to use a commode or a portable bedside toilet, and then someone had to pick up my poop or pee and take it to the toilet and clean it out. And the first 2 weeks were incredibly challenging for everyone. I will say I think the hardest part, despite the physical pain, was the mental pain, not being able to have your freedom or do things for yourself or have independence or get in your car and go to the gym or go to your favorite restaurant or go shopping and get groceries. And the thing I had to learn during this time the most was patience. I started physical therapy pretty quickly after being discharged from the hospital. I'm just short of 3 months out from my PAO surgery, and I am now able to drive. I'm walking without a crutch or walker. I do have a subtle limp, but it's getting better each day. I am working so hard on strengthening my hip flexors, and my muscles around there. All right, it's a Sunday morning. I'm about to go into the gym, and I'm just feeling so grateful for where I'm at right now with my pain levels, with the ability I have to go and work out. And I do have to do this surgery all over again on my left hip in October. I think going into this surgery, though, I'll have a little bit better of an idea what to expect, and it's also my non-dominant leg, so I'm hoping that this one's a little bit easier for me. But I'm envisioning a future Bracia who lives a pain-free life and is able to actively live out her dreams and work hard and grow in her career and travel and continue growing in her relationship with her boyfriend. And I'm so excited for that version of myself. And I am scared for this next surgery, but I'm also ready. I'm ready to get it over with. I'm ready to be strong and have courage and get through this with grit.
Hey, future Bracia, you're gonna have your second surgery in October, and I just want you to remember how strong you can be and brave. And after this surgery, you're gonna live with no pain in your life.
Something I will say for anyone who's going through any form of health challenge is health insurance is a pain in the ass. It is so difficult. I spent hours, days on the phone with my insurance company prior to my first right hip procedure, and up until the very day before my surgery was dealing with insurance challenges. I can't even tell you the emotional distress that insurance has caused me in my life. And unfortunately, I turned 26 in between my first surgery and now this second surgery, and I had to enroll in my insurance as an individual, and that has been a whole process as well. But I think I'm close to having it all figured out moving forward. I'm hoping that this next surgery can be a little bit easier beforehand with getting prior authorization. But if you're going through a health challenge and you're dealing with insurance issues, you are not alone. And if you're going to be going through PAO surgery or are living with hip dysplasia, I want to tell you that I know the process is so painful mentally, physically, emotionally, and I'm here rooting for you, and I know what it feels like. And I really don't think that there's enough information on patient stories and stories of hope for people going through hip dysplasia, which is why I think it's so important to share your story. My journey with hip dysplasia is not over, but I wanted to make this first video to show that there is hope and light, and I can see a clear light at the end of the tunnel. Thank you so much for watching this and for hearing my story, and please share this video with anyone you know who may be going through a health challenge or hip dysplasia, and follow along for more content and vulnerability and authenticity on my channel.